So I'm going to talk about the acromioclavicular ligament sprains, also known as a separated shoulder. This is an acute injury to the ligaments that hold your collarbone or clavicle to your shoulder blade. This is caused by forceful contact to the shoulder, which is common in ice hockey. Signs are a decreased range of motion, shoulder or arm weakness, shoulder bruising or swelling, as well as a lump and swelling at the top of your shoulder. And symptoms are shoulder pain. So treatments for a mild shoulder separation can be treated with rest and ice, over-the-counter painkillers, and anti-inflammatories, as well as mobilization with a sling and some physical therapy. Severe shoulder separations may include avulsion fractures and can require surgery to reconnect, realign, or stabilize the ligaments. Shoulder separations can be prevented through proper stretching and warm-ups prior to games and practices. Strength and conditioning programs can be used to strengthen the area around the joint. Proper fitting shoulder pads and protective equipment should always be worn. And for those with previous injuries, a shoulder brace can be fitted.
Morton's neuroma is a chronic stress injury of the nerve, typically between the third and fourth metatarsal, caused by tight, rigid fitting ice skates with narrow toe boxes. Most typical sign is limping. Upon examination, there will be a palpable nodule in minor cases, a visible nodule in severe cases. Treatment can include activity and footwear modification. In mild cases, the application of ice. In severe cases, injection therapy could be necessary. Orthotics and padding can be used to help alleviate some of the pain, as well as medication, which can be prescribed for pain and inflammation. Worst case scenarios, surgery can be recommended if none of the other modalities work, because there is only a 60% success rate. Prevention of this injury includes having proper fitting ice skates from a young age, as well as limiting the time spent in those skates, and in later years using preventative orthotics.
So a medial cruciate ligament injury, or an MCL injury, is the second most common injury in hockey. It's usually caused by a direct blow to the lateral side of the knee. It can range from mild to severe and can resulting in a slight stretch to a partial or a complete tear. Now we are going to talk about signs, symptoms, and treatments for an MCL injury. And there are 3 grades. For grade 1, there may be no signs at all. There can be slight pain, and some treatment methods will be rest, ice, anti-inflammatory drugs, and PT if necessary. For grade 2, there will be swelling and bruising and an instability in the knee, and it will be very painful. And some treatment methods for that will be a weight-bearing brace. For prevention methods, you can do strength and conditioning to increase the stability in your knee, simply having rule changes to increase penalty for low body contact, or wearing a stability knee brace for those who may be susceptible to an MCL injury or those who may have had a previous injury like this. So our second chronic condition is a torn acetabular labrum. It can be chronic or acute, but for this, we're going to be only focusing on the chronic condition. It is caused usually by repetitive stress injury, or frequently seen in goaltenders due to their butterfly style of play. Some signs of a torn acetabulum can be weakness, changes in your gait, limping, and a decreased range of motion. Also, some symptoms which can inform you that you may have a torn acetabular labrum. You can have pain through your range of motion, feeling of catching or locking in the hip area, or pain through the groin and pelvis. Some treatment methods can be arthroscopic surgery. You can either clean up the wound or do a full reattachment of the labrum. Also, there is physical therapy and rest involved with the treatment, and some medications such as anti-inflammatory drugs and pain relief drugs. Some prevention methods can be stretching, such as yoga and Pilates, or stretching exercises, and avoiding full body weight in a butterfly position.